Minister, can we begin with the infectious disease hospital? On Monday, you had mentioned that there were about 51 persons in the hospital and about 12 in the ICU. I wanted to know I mean, being in the ICU, we know it's serious, but if you can probably guide us through as to how serious are those cases, and then how many of these patients received or will be receiving the COVID-19 vaccine.
So those persons who we have in the ICU, they're there because they're having a lot of difficulty breathing in most cases, and then they might have other complications. So we would manage them in the ICU because we want to ensure that they're getting assistance with their breathing. We can start out by using CPAP machines, and then eventually, if that doesn't help, then we'll normally intubate. We also have other meds that we use in the ICU to make sure that we can assist those patients. So that has been our practice, and we have a dedicated team in the ICU that has been working with these patients. We have intensivists that are specially dedicated to working with those patients to make sure that they don't have, or at least we can help to reduce the challenges that they're having with breathing by providing them with these breathing apparatus and so forth. And the medication that we use, we have continued to use remdesivir with some of these patients. We continue to use the steroids like dexamethasone. And of course, we have convalescent plasma available to patients. But apart from that, some of these patients would also develop other types of complications, including problems with their kidneys or other issues. And depending on what complications come up, the team would also have to manage those as well. So those patients are really sick, and therefore they require extra attention, additional care, and that's what the ICU has been providing. So you know, we have capacity for about 25 patients in the ICU, and the team there is quite experienced now because they have been working with COVID patients for the past year, so they have acquired a lot of experience, and we do have ongoing training where we introduce whatever is the current guidelines and practices. As you would recall, just about a week ago, we had completed some training guidelines with PAHO, WHO, pertaining to the management of COVID-19 patients. So some of those guidelines are what we are using at our ICU in the infectious disease hospital.
All right, and will those patients, I guess it's a case-by-case basis if they'll get the vaccine?
We would prefer for them, if they already have the infection, we'll wait until they recover and then give them the vaccine. The guidelines have been that if you're already infected, that because you're infected, your body would start reacting to produce antibodies. So at that point, there's no need for the vaccine. The vaccines really help to prevent you from getting the severe form of the infection. So you want to give people, healthy people, the vaccine so that their immune system develop antibodies, and then if you come in contact with somebody who has COVID, that you're able to fight the disease off, right? So you don't want to give a sick patient the vaccine after they recover. Then because when they recover, their body, they'll still have antibodies. So that would be protective to prevent them from getting a reinfection. And then maybe after a month or two, you can then give them the vaccine.
Okay, I did read you did mention that the WHO had asked persons who would have recovered to delay and allow other persons.
Yes, and while I think the WHO's recommendation is primarily because of the scarcity of vaccines, So if you had the infection and you recover, they were basically saying, give somebody else a chance, because at least for the next 2 to 3 months, your antibodies would help to protect you. But, you know, once we get enough vaccines, we'll be able to make sure that everybody get their vaccine.
While you were speaking, you mentioned remdesivir, and I know you inherited a system of, well, the drugs, basically, huge drug shortage and so on. I just wanted to ask, how have you been managing, especially that we still have that shortage right now?
Well, these we had procured on special order because this is one of the medication that has some efficacy. It shortens the duration of stay in the hospital. And so we went out and we were able to buy remdesivir for our patients. So this was an emergency special order because of the circumstances.
All right, thank you, Minister. I wanted to ask my last question. So the resumption of the Guyana ferry service, have there been any imported cases recorded? And generally for all ports of entry in the country, have we seen an increase or decrease in cases?
Well, now that the U.S. has implemented strict guidelines in terms of travel, to go to the U.S., you require either an antigen test or a PCR test. And to come to Guyana, you require a PCR test. So most persons who have traveled so far and in compliance of that PCR testing, we don't really see many of them having travel being positive. There were a few cases where people who needed that, whose test was beyond the 3 days, when they had the second test at Chadijagan, we found a few people who were positive. But I can get the updated report from that exercise. I don't think we get very much these days. That has been reduced drastically. In terms of the ferry, a requirement to travel on the ferry is that you must have a PCR test, either going or coming. And if you're positive, of course, you would not be allowed to travel. So we haven't seen any cases of persons who have come on the ferry being positive.
Okay. All right, Minister, thank you so much for speaking with us.
Thank you very much for having me.